Hello everybody, welcome to today's Medcan online seminar. We are very happy that you could join us. My name is Tanya Haas and I am the Health and Wellness Writer here at Medcan. And before I introduce our presenter today, I just wanted to cover a few items. This presentation is being recorded and will be made available at medcan.com under Medcan Insights in the next few weeks. We'll also have a recap of this in our upcoming newsletter, so hopefully you're signed up for that. Now, you have all the information in your emails, but if you're having trouble with audio, just follow back with your email and you'll be able to get any audio issues fixed. And due to the volume of participants we have online, we will be muting all incoming audio to ensure clarity. So if you do have a question for our presenter, we do have an FAQ section. You will be able to submit your questions during the seminar in this little box that you should see on your screen. So feel free to submit your question, and our presenter will be able to review the questions throughout the seminar. And if we have time, we will try to address all the questions throughout at the end of the presentation. So with all that, and finally, the information in this seminar is for educational and information purposes only, and is neither intended to be relied upon nor to be a substitute for professional medical advice, diagnosis, or treatment. Now, with all that being said, I have the great privilege to introduce our presenter today, Kris Aiken. So Kris Aiken is the co-owner of Nurse Next Door here in Toronto. And Nurse Next Door, we're going to learn more about it later, is a home care company where they help people maintain health, well-being, and personal independence by enabling individuals to remain safely in their homes with dignity, independence, and quality of life. Now, Kris is a Montrealer who moved to Toronto in 2004, and you may recognize his face if you are a football fan, because he played with the CFL with the Toronto Argonauts. And when his football career ended, Kris put his physiology and biomechanics education to use and began a 7-year tenure working in the healthcare industry as a surgical device specialist. So he took that, healthcare industry and physiological expertise, and he worked in hospitals across the province and also in Manitoba. And through that time, he tells me that it became evident that the current healthcare infrastructure cannot support the aging population. And he was seeing that day in and day out. And due to the high cost of hospitalization and overcrowded rooms, Kris believes that too many seniors are forced back into their homes while they could still benefit from care and support. And often those needing care and their families do not know where to turn for help. And that's where Kris comes in, and where Nurse Next Door comes in. So we're going to learn more about that throughout today's presentation, and I'm just very happy to have Kris here as our presenter. So thanks, Kris, and I'm going to turn the mic over to you.
Thanks, Tanya, and thanks, Medcan, for having me here today. This presentation really came about from our experiences working with different families across the city. So many times we meet families that are struggling with two key things, and often these two key things are in a time of crisis for the family because somebody's in an urgent care need situation. People don't always know what the options are that are available to them, and sometimes they don't even know what their loved one's wishes are in that situation. And when it's a crisis situation and you're under pressure, that can make these things 10 times worse. So today we're going to sort of go over a bunch of tools that will help people navigate the system and hopefully prepare them in advance for the needs of themselves or their loved ones, so they won't have that uncertainty and stress if they find themselves in the situation that families often do when they call us. We're going to go over how to recognize it might be time to get some help. We're going to go a little bit deeper specifically with dementia and sort of what that looks like. What are the differences between normal forgetfulness and signs of a real cognitive impairment that may need you to lead to try to find some care for a loved one. We're going to talk about how you're not alone. The baby boom generation is starting to reach their senior years, and the number of people that are going to be needing help is going to double by the year 2030. So this is going to be a very common thing that unfortunately a lot of people here listening may have to deal with, or they're going to know someone who's going to have to deal with in the very near future. We're going to go specifically into what are the public options, what does the government have in place for us today that can help you, and what are your private care options. And lastly, before we leave today, we're going to talk about how can you have a conversation early with a loved one about your wishes or their wishes, so you're prepared in advance. All right? So hopefully that will answer everyone's questions today. So when is it time to maybe have a conversation or to look into getting care? Well, potentially you've noticed that there's some major memory loss happening and starting to affect someone's daily routine. People are having trouble keeping up with regular tasks like cooking, cleaning, or personal hygiene. Someone may have been diagnosed with a degenerative disease or they're displaying symptoms of dementia like confusion, agitation. Maybe it's getting harder for them to carry and move items or walk around their own home. Or you've been caring for them, but you no longer have enough time or energy. That's a common situation that we see with people that call us for help is they've been caring for mom or dad. They've also got children, a job, a husband, social life, and they're just burnt out. But really, two common questions we hear are, how do we tell the difference between normal memory loss and Alzheimer's disease? And even before that, sometimes we get, what's the difference between Alzheimer's and dementia? All right, so if we sort of look at the next slide, dementia is really an umbrella term that encompasses a whole bunch of different cognitive impairments, whether it's Lewy body dementia, vascular dementia, frontotemporal dementia, or Alzheimer's disease. All of them are forms of dementia. The dementia is just coming from a different source, right? So here we've got a list of what's normal memory changes compared with signs of actual degenerative disease. So misplacing your car keys, forgetting a word, those things are normal. They happen to all of us. I do it all of the time, especially now that I've had children because my brain power is elsewhere. We really need to start to be concerned for ourselves and for our loved ones when a couple of key things happening. If we start to forget about the fact that we're forgetting things, that's a sign. If we're having episodes of disorientation in familiar places, that's a sign. Are you having trouble following directions, or is mom or dad having trouble following directions? That's a sign. If you notice someone's using words in incorrect ways, if they mean to say, the other day the door was stuck, but instead of using door, they use the word apple, right? Those are a key, clear sign that there may be some true cognitive degeneration taking place. And lastly, if someone has a real change in personality, especially in a social situation, maybe they're a little bit more overt, or maybe they're making inappropriate jokes, when that's not a normal personality trait for somebody, that also would be a sign that there's maybe some cognitive impairment happening there, and you should seek some help and also seek some medical attention. So as we talked about, this is obviously a prevalent issue in Canada right now. Currently, there's over 700,000 Canadians that are living with some form of Alzheimer's or dementia, and the numbers are going to double by the year 2031. So know that you're not alone if you're going through something like this. But for the first time in Canadian history, there's more people over 65 years of age than there are children in this country. And right now, unfortunately, our healthcare system, as we know, is already stretched to its limits, and it's only going to continue to get stretched. And again, these numbers are only for dementia. It doesn't take into consideration heart failure, stroke, diabetes, all the reasons why people end up needing a little bit more assistance as they age. So we talked about the impact on our healthcare system, but there's also a huge impact on families. I love infographics. I think this is a really interesting one. You know, this is the current data of what's taking place in Canada right now from family caregivers. Family caregivers make up to about 70% of the labor force. It's unpaid labor of people that need help. Right? 30% of it's being done by professionals, 70% is being done by someone in someone's family right now, which is obviously leading to lots of lost income in terms of wages, lost productivity for the companies that people work for. But the most, I guess, stark and scary sort of statistic on this is the number of people that are facing some form of mental illness because of the stress that they're under trying to take care of a loved one. So just know that it is okay to ask for help if you're in a situation like this now and you're finding it overwhelming. So now that we've talked a little bit about sort of what to look for, and we know that there's a high probability that, you know, we're going to have to face this all ourselves in the coming years as our parents age or our loved ones age, what are the options that are available? Well, we're fortunate enough that we live in a country that has a lot of free healthcare. So there are services that are government funded, right? Obviously, we know we can all go to a hospital and our hospital visits are going to be covered. We can go see our doctors and our visits are going to be covered. The government does provide some in-home care for people as well. And the government is heavily involved in the long-term care centers, right? LTCs, what we're going to refer to a lot during the presentation today. And that's usually what people consider a nursing home, right? That's where you go when someone needs really 24-hour care. It's intended for people that have cognitive and or physical conditions that really they can't be alone, right? You need to be sort of assessed and deemed eligible before you move into a long-term care center, but those are the big sort of government-funded systems. So a lot of people may have heard the terms LHIN, Local Health Integration Network, over the years, or maybe you've heard the term CCAC, Community Care and Access Centers. Those are two of the government agencies that have been responsible for making sure that we have the support that we need as a citizen when we do need it. Recently, the CCACs have been dismantled, and the LHIN is now going to be responsible for all of the home care and the funding for the long-term care centers in the province of Ontario. That transition is finishing up at the end of this month, so by August 1st, everything should be complete with that transition. That being said, I'm sure that people are still going to refer to it as CCAC home care for the next 15 years because it's just so ingrained in everybody's heads. Right now, if someone is sort of deemed that they need government-funded home care, generally speaking, they're going to meet with a care coordinator for the CCAC, now the LHIN, and that person will assess them, talk to them about their needs, and decide how much and what help is appropriate, whether it's personal support work, whether it's nursing support, whether it's a physiotherapist that needs to come to the home. Generally speaking, most people receive somewhere between 3 and 14 hours a week of help from the government. So whether that's a couple days a week of someone coming in to help you have a bath, do a little bit of like housekeeping for you, it's usually pretty quick in and out, and there's usually a service sort of window that someone will arrive between 9 and 11 in the morning, help you with that task, and then they're going to be moving on to help somebody else. Private care options are virtually unlimited. Senior care is one of the fastest growing industries, obviously, as that sort of population demographic changes, and new options are becoming available all the time. Private care options that you can sort of choose from now are active living communities, which are generally speaking ideal for healthy individuals, usually beginning their retirement. They want accommodation and services in a community of their peers. If you're going to live in an active living community, you're usually not going to require any assistance with your day-to-day activities. These are usually purpose-built houses, apartments, gated communities, and they're reserved for seniors, and they're oftentimes sort of centered around some sort of activity or hobby, whether it's golf or art or something else. Independent living facilities is what we usually refer to as a retirement home, right? Everyone knows somebody who's lived in a retirement home at some point in time. That's what we refer to as an independent living facility. These are ideal for seniors who want to live in a community of their age, usually with people of similar interests. More often than not, the residents of an independent living facility are in good physical and cognitive health and need only some light assistance with tasks such as laundry, transportation, and meal preparation. Some of these retirement homes also offer assisted living floors. Not all retirement homes are set to handle someone who needs personal care on a regular basis or has any sort of cognitive impairment. So if you are looking into one of those options, be sure to ask questions about that. Is there the ability to transition as someone's condition may or may not change? But yeah, some retirement homes will have assisted living floors, and they will have a little bit more ability to help with personal care needs. If someone's mobility really declines, they'll often be equipped with different lifts and devices that will allow movement and ability to get activities of daily living completed for the resident. There's day programs are an option for people as well, and they're really just what they sound like. They're a place for seniors to go who need extra support for the day if they'd like to be more social, or their care needs are such that if their primary caregivers at work for the day and they can't be left alone, they need to be able to go somewhere where they're safe and taken care of. More often than not, the day programs are focused for people with some sort of cognitive impairment, someone who's living with some form of dementia. That's usually the type of patient that is going to be at them. And then private home care is the other option that's available. If people want to age in their own home, which we know is one of the most important things to a lot of seniors that we've surveyed, people will try to maximize their government-funded home care, and then they would top up the rest of their needs with a private duty company. And it can take on a variety of forms depending on the needs of the individual. The biggest advantage of home care is that it's tailored one-on-one to a person's needs, right? So if it's very customizable, you can have personal support, you could have nursing, you could have physiotherapy services, and started early, generally speaking, home care is the best way for a senior to maintain their independence, avoid an emergency situation, and be able to live out the entirety of their lives in their own home. So we've talked a little bit about what the options are, and usually we get a lot of questions of what do things cost, right? If I want to choose this option, it sounds great to me, what is it going to be? So we're going to take a look at what are like the sticker prices on these sorts of things, and what are the hidden costs that you need to ask about and look about depending on which option you're going to be choosing. So typically, home care, again, it's concierge type services more often than not and tailored to your needs. And this is private duty home care. Obviously, the government funded LIN home care now is free of charge, but it usually includes personal care, meal preparation, housekeeping, companionship, escorts to and from different appointments or activities. And it usually costs somewhere between $500 to $6,000 per month, depending on how frequent you'd like someone to visit. Independent living facilities have a huge range, especially here in the city of Toronto. There's independent living facilities that start at $2,500 a month and work their way up to over $10,000 a month. And you have to remember that an independent living facility doesn't include any care. So what you're going to be getting for that is you're going to be getting a room or a suite. You're going to be getting 3 meals a day. And then obviously some facilities are going to have different amenities than others, whether there's fitness rooms, salons, pools, and that sort of thing. Retirement homes that have assisted living floors, the cost range is usually somewhere between $4,500 to $15,000 per month in the city of Toronto. And generally when you start to go to assisted living, you're starting to get things included like medication management. Some of them will have memory floors, so they'll do some Alzheimer's or dementia care. Usually there's a nurse on site at the assisted living facility, and they'll usually provide a little bit of housekeeping. And then obviously long-term care is generally built for people who need the most amount of attention. Those seniors or those people who need really 24-hour support. It's government subsidized, so the person will only pay out of pocket anywhere between $1,600 to $2,500 per month, depending on if they want a shared or a private room. Because it's subsidized and you have to be deemed in need, there's often long wait lists to get into a long-term care center. We've seen anything from 5 to 24 months, depending on how sort of insistent people are of waiting for their first choice of facility. What are some of the extra costs you might face once you've gone down the path of choosing which option you think is best for you? Well, with private home care, the client, generally speaking, is responsible for the cost of supplies, right? So if you need briefs or gloves or cleaning products, that's something that's usually going to come back to you on your invoice from the home care company, as well as travel costs as well. If the home care agency is going to be driving you to and from doctor's appointments or to and from social activities, there'll generally be a kilometer charge. Or if the caregiver is traveling with a taxi and the company has a taxi account, you usually see those taxi charges show back up on your invoices as well. With independent living facilities, there's pretty much a charge for everything. The list is long and varied, and that's why we sort of chose these comical caricatures. But meal tray service is something, so if you can't come down to get your meal, right, because independent living facilities all have set meal times and you need a meal brought up to your room, that's going to be a charge. We've seen it up to $20 each way. $20 to bring your food up, $20 to bring your food or your empty tray back down. Escort within the building. If you want to go from your room to an activity and you need someone to help you get there, there can be a charge for that as well. $4 to $5 each way. Medication management is usually a bundle package with these facilities as well. So if you need it one time a day, it can be, you know, close to $300. If you need it multiple times a day, it could be close to $700 a month. So costs definitely go up, and I can go on and on, whether it's wellness checks or bed making. But again, independent, and that's what a lot of people don't understand, is independent living facilities are meant for people who are independent, right? So when you're comparing the cost of home care to the cost of a facility, it can sometimes be even less expensive to stay at home, provided you're not needing 24-hour assistance. So how would you go about choosing which option is best for you or your loved one? Well, it really depends about your personality, right? Retirement homes are really ideal for independent seniors, seniors who enjoy group activities, seniors who like set schedules and meal times and companionship while they're having their meals. And home care may be better suited for seniors who want to keep their own routines, seniors who are house proud and whose home holds fond memories, seniors who prefer a high level of privacy, and seniors with early to mid-stage dementias may fare better staying in their own home. There's some evidence to suggest that moving someone out of a familiar environment with early to mid-stage dementia could speed up the progression of the disease. So we often suggest that, you know, staying at home could be a good way to slow the progression. We also work with a lot of people who may have gone into the hospital for an extended stay because they've had a fall or a bad infection. And while they're in the hospital, they show signs of cognitive impairment, which may not be a true dementia. It could be more of a delirium, which upon return home could actually reverse itself, right? So if you're in a situation where you've got a loved one who's had an extended stay and you feel like, oh my gosh, all of a sudden they have Alzheimer's or dementia, it may be induced to potentially infection. It may be because of the lack of consistent environment for so long. They may not need to go into a facility where they require 24-hour care. If they go home for a month with a significant amount of assistance, some of those things may resolve themselves and their care needs may drastically decline once they do. So I don't know, because I can't talk to everybody that's on the seminar today or the webinar today, but I have a feeling that some of you probably have a loved one who you feel needs some care. And if anything is consistent with what we see on a regular basis, that loved one could be very resistant to having some care. This is a very common thing that we see at Nurse Next Door. So we often help sons and daughters or husbands and wives with tips to persuade their loved ones to accept help. One of the first things we suggest is seek the advice of a trusted professional. Physicians can be a really good ally in getting people to accept help. Alternatively, sometimes bringing in a home care agency for a consultation, which is usually done at no charge, can be a good way to get someone to have an outside or quote-unquote expert opinion, and can often go a long way with convincing your loved one that they do in fact need a little bit of assistance. The next thing that we suggest sometimes is hire someone to manage the household chores, to cook some nice meals, to do some housekeeping, not to take care of the person that you think needs to be taken care of. I think as humans we have this great desire to maintain our independence as much as possible, and to hear that you need someone to come and take care of you is not a fun thing to hear. But I don't know about anybody else here, I like to have meals made for me and I don't like cleaning my home. So enticing me that way to have someone come in is a little bit better of I guess an angle or a tactic to take. It can sometimes be a great way just to get that caregiver's foot in the door the first way. The bonus is that person coming in to do that light housekeeping, do that meal preparation, could also be someone who specializes in whatever sort of care you think your mom or dad needs. Potentially it's a nurse, potentially it's someone with a ton of Alzheimer's or dementia experience. If both parents are at home, it can often be good to direct your attention to the less needy one, right? Which sounds a little bit counterintuitive, but maybe, you know, let's say your dad is really declined, right? But mom's doing pretty well, but you can tell mom's burning out. Well, let's focus a little bit on mom's needs, dad. Mom needs the help. It's not you that needs the help. Mom needs a little bit of extra assistance around the house. Mom needs a little bit of help with some cooking and meal preparation. That can be a great way to help get that caregiver in the door as well. Potentially, you need to focus on you and your needs, right? we have to remember that our parents took care of us for a lot of years, and they still want to take care of us, and they want to feel like they're taking care of us. So if you let your mom or dad know that you're stressed out, you're not sleeping, you're not eating, you can't think well at work because you're worried about them all day long, and ask them, please do this for me, they may be more inclined to accept some help that they were resistant to try to have. And the other alternative is when it's time to make a decision or you feel mom or dad needs help, let's go visit some nursing homes. Let's go visit some long-term care facilities. Let's go visit some independent living facilities, and let's see what you like, what you don't like. Is home the best option, or do you want to go live in a community? But sometimes the thought of moving out of your home can be enough to say, okay, maybe I should just get 1 day a week of help to start, and things can go from there. We also say give your parents a potential way out. Let them know that this isn't a permanent thing. Let's try it for a month or two and see how you like it. If you don't like it after a certain amount of time, we'll cancel the service. Most home care companies don't have any contracts. You can discuss money. Again, right now, and it may change as we go forward, but right now the current generation of seniors who really need assistance, a lot of them grew up during wartime. So they grew up when things were scarce, and they don't want to spend money on themselves. They hold on to the money tightly. If possible, remind them that they have plenty of savings. If they do, let them know that spending money on their happiness and keeping them in their own home is much more important to you than a few extra dollars of inheritance. Right? That can often be a way to get someone to take help. The next one's showing them the stats, a little bit of fear incentive here, but 1 out of every 3 seniors will fall this year. And a fall, as we all know, can be a really detrimental thing for somebody. Almost all falls lead to some sort of injury or hospitalization. And chances are maybe your mom or dad's had a fall or 2 already, and remind them about how serious that can be for them. Number 9, I really like, ask people about their fears and their goals. Again, we're going to talk again before the day ends about, what are good conversations to have early, right? But ask people what they fear about getting older. Studies show that the number 1 fear of people that are aging is losing their independence. The number 2 fear of people that are aging is being forced out of their own homes and into a nursing home, right? So ask them what their goals are and start working together to help make those goals come true. And if all else fails, but you really feel that mom or dad needs help, hire a quote-unquote friend to help your parent. We've had to do elaborate things sometimes where we're bumping into people at coffee shops. I had a client one time that made me go to a seniors movie where I could bump into her husband, and because I spoke French and he spoke French, we were able to hit it off, and that's what enabled them to start getting some care into their home. But it was a huge relief for this woman who was just completely burnt out, but her husband kept sending all the caregivers away. All right, so we can get elaborate and we can get creative, but there's a way. So what do you do if you find yourself in an urgent need? Again, when we talked at the beginning of the presentation, a lot of the people that call us from the hospital. They call us in a situation where mom or dad's had a fall, mom or dad's had a stroke, mom or dad's had a very intensive surgery because they were diagnosed with something, and now they don't know what to do. I'd say that's 70% of the time for us. We're always happy to help people in this situation, and we'll often even come to the hospital and sort of navigate the system for people to get them the answers. They may end up working with us, they may end up not working with us, it depends on what their real needs are. But what I can go over today is I can go over sort of what we do and give you our questions, who we try to look for, who we try to ask to. So if you find yourself in that situation, you'll know what to do. So if I get called in by a family and I go personally, these are actually my questions that I ask first. So my first goal when I arrive at the hospital is I want to get in front of the right person. Not everyone's going to know all the details about mom or dad's discharge, when they're going to go home, or what's going to be available to them when they do. So immediately I go to the nursing station and I'll ask, who's the social worker or the discharge planner, the CCAC, now I may say Lynn, representative who's working on so-and-so's file, right? Oftentimes I'll ask for the community care coordinator. And honestly, I've never made it through the full list of people before I've had somebody pick up the phone, dial one of those people, and ask them to come to speak with me. So I promise you, if you ask for those 5 people, someone's going to come and be able to give you some answers. Once you get in front of that person, really you're asking for, is there a discharge date? Does anyone have an expectation of when mom or dad's going to go home? And if yes, what resources are going to be available to help him or her, or me, or yourself, because yes, you do matter too in this, to cope with the changed abilities upon return home. You know, and from that point in time, once you get that information, you can then start reaching out to either a facility or a home care agency to help offset the load, right? We all know that the government funding is only going to go so far for people, and you may need to, you know, get your 3 to 14 hours a week, and then add another, you know, 2 or 3 hours a day with another company. But from here, we usually try to build a plan and a schedule that ensures every family member's needs are met. The person who needs the care themselves and the person who's going to be caring for mom or dad. And then again, I think that the most important thing is to start having discussions early, right? If you are starting to, you know, get into your senior years, express your wishes to your family now, right? If you are seeing your mom or dad getting older, bring up the conversation with them early rather than later. What are your wishes? How do you want to age? Where do you want to be? You know, we oftentimes deal with families where these conversations haven't taken place, and you've got one son or one daughter, one brother, one sister that wants mom or dad to go to the facility. You've got another son or daughter that wants mom or dad to stay at home, and there's bickering amongst the siblings, and everyone's unsure of what's going to be the best situation for mom or dad. So these are some suggested questions that we have, right? You know, ask your mom or dad, and some of these are hard, like they're not going to be the most easy questions to ask somebody, but how do you see the rest of your life unfolding, right? It's a good open-ended question. It's not a fun conversation to have, but it's an important one. Where do you see yourself living at age 70, at age 80, at age 90, at 100 years of age? Honestly, you'd be surprised, a lot of our clients are in the 95-plus-year-old range. People are living a lot longer these days, and it's going to continue to go. Would you like to live at home forever, or would you like to move into a seniors community one day? Under what medical circumstances would you like to be resuscitated? Have you ever heard of a DNR? A DNR is something called a do not resuscitate, and it's a conversation that we have with every single one of our clients. We have to ask when we first sign someone on, do you have a DNR order? And most of the time people go, what's that? And you have to explain to them, well, in case that you have, you know, a cardiac event, would you like us to perform CPR, right? Legally, a paramedic or a home care agency has to perform CPR unless there's a DNR that's been signed by a doctor or a nurse that's posted in the home. So when we get to those situations, because a lot of people we meet don't want to be resuscitated, we have to make sure that those paperwork are in order. And if you ever find yourself on life support, if you're in critical condition, is there a time frame that you want to be kept on? Do you want to be on at all? You know, and maybe even go so far as to how would you like to be honored after you pass? But these are difficult questions, not easy conversations. But if you take nothing else away from the presentation, please take away the sort of urge or incentive to have these conversations with the people that you care about, because you'll be thankful that you did.
Well, I know what I'll be doing at my next family meeting. Thank you so much, Kris. I know that we all learned so much during that presentation. It was so thorough and very interesting, so thank you so much. Now we do have some time for a few questions, and I see that we have some questions submitted, so we will address one or two of those. Now, just before that, I'm just going to go through a little bit more about home care at Medcan. So, as we've discussed, home care at Medcan is powered by Nurse Next Door, and we have combined with Nurse Next Door, which is a home care company where they help people maintain health, well-being, and personal independence by enabling individuals to remain safely in their homes with dignity, independence, and quality of life. So for our clients who require the support of a caregiver or a loved one, or prefer to recover from medical treatment or surgery in the comfort of their homes, we can help. The information, if you want to learn more information, please feel free to contact our client service team at 416-350-3621, or you can email clientservice@medcan.com. Also, we'll be sending a survey at the end of today's session, so if you have a desire to speak with Kris or his partner Laura, that's definitely a possibility, and we are really proud to be working with Nurse Next Door. So we're going to go to our first question. So, Kris, earlier this year, the Ontario government promised to increase funding over the next 3 years for senior care. Do you know what that will look like?
We've got a vague idea of what that's going to look like right now. The province earmarked a lot of money, $100 million over the next 3 years. Specifically, it's geared towards a dementia strategy that's going to include patients and their caregivers find some support to improve dementia care. They've said they will allocate increased funding to help caregivers, train and get access to resources. We're not so sure if that's going to mean that there's going to be more, government-funded home care where a professional will come in, or if they're going to try to make it easier and make families better prepared to provide the care themselves. That's what we're still waiting to see.
Okay, great, thank you. So you did mention, a few caveats, like unless they need 24 hours a day care. So this was the next question. What if a loved one needs 24 hours a day care, but the costs to stay home are prohibitive and the thought of a nursing home is not appealing? What are my options?
Yeah, well, we always work with the government-funded home care agencies as well through the CCC coordinators, and we help try to maximize the amount of hours that someone's going to get from the government. So let's try to get them up to that 14 or even higher as well. Then obviously ourselves or another home care agency could help provide help as well. And the other option is to sort of work, with multiple different choices, right? You have home care from the government, home care from private, and then work with day programs as well. The cost for day programs, because they're group settings, are obviously much less than it would be at a facility or at a home care. So a lot of people can spend their days at a day program, and the home care agency can even help get people dressed in the morning, get them breakfast, and drop them off at the day program. They'll spend the day at the day program, then the home care agency again will pick them up afterwards, get them home, make sure they have dinner, and then get them to bed at night.
Okay, well that actually leads to our next question. So yeah, what are some of the services that a caregiver can provide at home? So we saw some pictures, there's cooking,
Absolutely. We do a lot of meal preparation for clients. We do a lot of help with, bathing, dressing, incontinence care if someone's having trouble getting to and from the washroom at that point in time. Really all the way through to palliative care situations. We work with a lot of people who've chosen that they want to pass away in their own homes as well, in which case we'll have a team of nurses and personal support workers there that help with medication, whether it be injections, but there's a wide range. Really, it's virtually unlimited what home care can be done. Anything that can be done in a facility can pretty much be done in your home.
And what about compatibility? Compatibility with the home care provider. Not everyone gets along with everybody. So
no.
How does that work?
Well, we guarantee a perfect match. And what we mean by that is we've got a vast supply of home care workers, right? Personal support workers and nurses. And we try to hire a variety of personalities. Our care designers are experts in sort of making that perfect match, right? Trying to find the personalities that are going to go. If mom or dad's really, really talkative, we're going to try to get someone that's really, really talkative as well. If mom or dad speaks a certain language, we have a lot of caregivers that speak Italian, German, Chinese, Japanese, French. We can get those matches made there so we can help create those bonds as well. But we tell all of our clients, if you don't think it's a good match, let us know. We'll pull the caregiver and place a new one, and we'll keep doing that at no charge until we get that right match, until mom or dad are really happy. But it's interesting, sometimes families think they want something, and they'll say, I want a male that's this age, that speaks this language, and we'll put it in and it won't work at all. Next thing you know, you've got a female in there that's a completely different nationality, and mom or dad absolutely love them, and that was actually what they needed. But we'll keep trying until we find that right match.
All right, well, thank you so much, Kris Aiken from Nurse Next Door. I want to thank everyone who joined us this afternoon. And again, if you have any questions, there will be a survey, and please provide us with your email or phone number, and we'll be happy to follow up. Hope you all have a great afternoon. Thank you.